The miscellaneous anti-epileptic drugs are, in most cases, newer drugs, what we think of as second and third generation drugs. Table 14-1 in your textbook includes the classes of traditional anti-epileptics, the barbiturates, the hydantoins, including phenytoin, the aminostilbenes, including carbamazepine, and then there's a fairly lengthy list of miscellaneous anti-epileptic drugs, except for valproic acid, trade name Depakote. These miscellaneous drugs are considered second and third generation because they're newer. Valproic acid is considered a first generation drug, but it doesn't fit into any of the classes of the traditional anti-epileptic drugs. And so I've selected just a few of the miscellaneous anti-epileptic drugs to talk about in more detail. Some of the miscellaneous drugs are quite new. For example, brivaracetam at the bottom of the list was just FDA approved in 2016, and it is approved for partial onset seizures. And the other, let's see, I don't think it's even on your list, but it's in the notes here. The eslicarbazepine is a prodrug for carbazepine, and it was approved back in 2013. So some of these drugs are quite a bit newer than some of the original second and third generations, which were approved way back in the like around the early 1990s. So what are the miscellaneous drugs that I want you to know about? Valproic acid, or Depakote, the first generation miscellaneous that's in that list. And we know a little bit more about how valproic acid works. We have reason to believe that it increases the levels of gamma aminobutyric acid, or GABA, which is an inhibitory neurotransmitter, so it inhibits the transmission of the impulses, and so it slows down the seizure activity. Um, it is used to treat generalized seizures. It also has a use for a psychiatric disorder, for to treat bipolar disorder. It is available in oral forms and also can be given parenterally. It's highly protein bound, so you know that if there's inadequate protein available in the person's body, the patient's body, then there's going to be a lot more free drug available, and we're concerned about excessive action. It can cause hepatotoxicity, along with the drowsiness that is often a side effect of the anti-epileptic drugs. And it can cause transient hair loss. As you might imagine, that's pretty distressing to people who are interested in hanging on to their hair for the most part. The second and third drugs that I want you, and I'm taking them a little bit out of order: gabapentin, trade name Neurontin, and pregabalin, trade name Lyrica. And these two drugs are anti-epileptic drugs. Gabapentin is an analog of GABA, the inhibitory neurotransmitter. So it acts like GABA. It increases the synthesis, the generation of, and the accumulation of GABA between the neurons. So again, it can slow down conduction. And its adverse effects are more in the central nervous system and the GI effects. But gabapentin has also a use for neuropathic pain management. And it's actually more commonly used to treat neuropathic pain than it is to treat seizures. You can see that I just added the additional use to the slide, treatment of neuropathic pain. So it's useful in people who have neuropathy, maybe due to diabetes or some other condition. Then the pregabalin or Lyrica is it's a Schedule 5 controlled substance, and it is indicated as an adjunct therapy for partial seizures, not generalized seizures. So it's not a solo drug. It's not a monotherapy. It can be added if other drugs have not done a good job of managing seizures, but it's another drug that is more commonly used to treat neuropathic pain. The neuralgia or nerve pain that can occur after someone has an acute outbreak of herpes zoster or shingles. And that virus, the herpes zoster virus, can actually do damage to the nerves that it is that it that it is distributed along, and can leave a person after shingles with severe neuralgia or nerve pain. So in both cases, whether it's like a peripheral neuropathy because of diabetes, and pregabalin was originally marketed pretty heavily to people with diabetic neuropathy, or postherpetic neuralgia, it's useful for nerve pain, and then it also has a use in fibromyalgia. So gabapentin, pregabalin, both listed as anti-epileptic drugs, but used more really for treatment or managing neuropathic pain. Lamotrigine, or trade name Lamictal, is an anti-epileptic drug that is useful. It's indicated for managing several different types of seizures: simple, complex, generalized, and full-on tonic-clonic seizures. It is also used as a drug in the treatment of bipolar disorder. Adverse effects, the central nervous system kinds of effects, the drowsiness, but this is a drug that is possibly going to cause Stevens-Johnson syndrome as well. And Stevens-Johnson syndrome is a severe integumentary or skin reaction where the skin just is damaged and sloughs off. And the last of the miscellaneous drugs that I want you to know a little something about is levetiracetam, trade name Keppra. And this is another drug that is adjunct therapy. In other words, it's not monotherapy all by itself, but it can be useful for partial seizures. And some seizures start out as partial or more focal and then become generalized. And so levetiracetam is an adjunct for seizures that fall into that category, partial, and may or may not secondarily spread out over the brain and cause a more generalized seizure. It's pretty well tolerated drug, which is a good thing to say about anti-epileptic drugs. Although when it's given with other drugs that cause central nervous system depression, then you can see the additive effects and a higher risk of sedation.